and are informative. And before we actually begin today's webinar, Autism is More Than a Month, I'd like to thank our sponsors. Without their generous support, this educational series would not be possible. And you can see this slide has the images of our sponsors. Next slide, please. The title of today's webinar recognizes April is Autism Awareness and Acceptance Month, but also that autism is a lifelong journey that is unique to each individual. In the next hour, we will explore the impact autism has on individuals and families through the lens of three professionals with very different experiences, lived experiences with autism. Whether you live with an autism diagnosis, work with people who have autism, or have loved ones on the spectrum, each person experiences autism in their own way. Every experience is valid and has value as we seek to understand and support each other. Next slide, please. Autism spectrum disorder, ASD, is the full medical name for autism. Autism is not a disease. There is no cure, but therapies and early interventions can help identify strengths and improve results. People with autism are neurodivergent. Their brains develop or work differently, which results in different strengths and struggles compared to those with typical brain development. Autism is a broad term that includes a range of characteristics. Just as each person is unique, no two people with autism experience it in the same way. Autism is often misunderstood. Despite decades of research and past practices that have not always been helpful, we are learning to do better by our loved ones on the spectrum, but it continues to be a work in progress. Next slide, please. The latest numbers on autism prevalence were released last week, based on data gathered in 2022. According to the Center for Disease Control, autism impacts 1 in 31 8-year-old children in the United States. Males are 3.4 times more likely than females to be identified with autism. Autism occurs in all racial, ethnic, and socioeconomic groups. It seems like autism is becoming more common, but the increasing prevalence is likely a combination of factors, including improved medical expertise as providers are better at diagnosing the condition, more public awareness, which impacts the services available, more people seeking diagnosis to access early intervention and therapies, and changes to the diagnosis, which we will explore further in the next slide, as well as new rules. In the past, healthcare providers weren't allowed to diagnose a person with both autism and attention deficit hyperactivity disorder, ADHD. Once that changed, both conditions became more common, as they often occur together. While better detection and awareness explain part of the increase, we're also seeing a rise in more children being diagnosed with profound autism. That's significant because profound autism typically presents with more visible and unmistakable characteristics. It's not something that would have gone unnoticed in the past. Research points to a complex mix of factors behind these increases, including genetic susceptibility and the influences on gene expression that may be shaped by environmental conditions. So while improved screening plays a role, it's only one piece of a much larger picture. In 2013, the American Psychiatric Association revised the Diagnostic and Statistical Manual of Mental Disorders, DSM, and how it addressed autism. DSM-5, which is the latest edition, is meant to help healthcare professionals make diagnoses. The goal with the autism revisions was to provide for more accurate diagnosis, identify symptoms that need treatment or supports, and better assess severity levels. So DS5 did several things. First, it combined previously separate categories such as autistic disorder and Asperger's syndrome into one umbrella diagnosis of autism spectrum disorder. Second, it developed the severity. It combined 3 previous autism characteristics such as social impairment, language communication impairment, and repetitive restrictive behaviors into 2. It added sensory issues as a symptom under the restrictive repetitive behavior category, and it added assessment for any known genetic causes of autism, such as Fragile X syndrome, Rett syndrome. So why the DSM-5 levels of autism matters. We've got 3 levels now where we're explaining the number of supports that are required. Level 1 is considered the lowest level of support needed and has the least severe symptoms. Level 2 requires substantial support with more severe symptoms that cause greater impairment. And level 3 requires very substantial support and the most severe symptoms. While autism has, as the diagnosis showed, is defined in 3 levels, it's described as a spectrum because its impact varies widely from person to person, but it's not linear. While development specialists roughly categorize ASD severity using the 3 levels mentioned in the previous slide, it's not an exact science. It's a subjective measurement. Levels help clarify the severity of ASD symptoms to tailor services and support specific to an individual's needs. And while the levels describe current symptoms, we all know that that can change over time. Also, levels should not be used to determine a person's eligibility for specific services or treatments. The levels do not replace the need for individual assessments that include the patient's personal priorities and goals. As you may know, people within the autism community don't always agree. A controversy surrounds many aspects of autism. There is one thing, however, in which we can all agree. Autism impacts people differently. Making blanket assumptions about what a person can and can't do could minimize real struggles and overlook meaningful skills. For instance, because a person is non-speaking does not definitively mean they're nonverbal or totally without words. Defining someone by their perceived ability or lack of ability could underestimate or fail to recognize strengths for people who do not fit squarely into those standards. Today, we will hear from 3 people who have different lived experiences and perspectives on autism. As we seek to strengthen our understanding and supports for the autism community, it's important that all voices are welcomed, heard, and respected. When we listen to each other, we open the door to increased understanding, so together we can support our community better. No matter how you or your loved one's life has been touched by autism, we are a community, and our community is stronger together. I would also say we are a community that is facing some real concerns with the current climate, at least at the federal level. And so that part of being stronger together becomes even more important. So before we jump into the next portion of our presentation, I'd like to just take a few minutes to introduce our panelists today, and especially to thank them for the work they do every day to increase acceptance and supports for people with autism and their families. I especially want to thank them for taking time out of their busy schedules to share their views and experiences with us. So first on the panel I'm going to introduce is Judith Doherty. She currently works at the Mass Department of Developmental Services, DDS, as a 688 Transition Service Coordinator. Prior to that role, she was a service coordinator for individuals with ASD only. Before joining DDS, Judith worked for many years at nonprofit agencies such as Bridgewell and the Autism Support Center at the Northeast ARC. She has also served as a board member for Advocates for Autism, AFAM, and on the Governor's Autism Commission on Adult Services. Judith holds professional licenses in elementary education and moderate disabilities. She is the parent of an adult daughter and son with profound autism, one with many medical needs. Thank you, Judith, for being here today. Betsy Johnson is an autism consultant and educator who works closely with autistic adults as they pursue their educational, employment, and personal goals. She partners with organizations who want to better support their neurodivergent employees. In addition, Betsy is a parent educator at UMass Chan Medical School through Operation House Call, the ARC of Mass program to educate medical students. She also serves on the CareQuest advisory panel at the Tufts Dental Clinic, is collaborating with dental professionals to reduce barriers autistic patients face in assessing oral health care. Betsy is a creative writer and published poet and the proud parent of a shining star autistic young adult. Thank you, Betsy, for being here. And finally, our youngest panelist, Corbin Johnson, they, them, is an autistic queer actor and self-advocate. They are the Associate Director of Spectrum Theater Ensemble's Neurodiverse Inclusive Certified Entertainment Program, which trains and certifies performing arts spaces in neurodiversity accessibility. They have worked with and certified multiple theaters across the country, including the American Repertory Theater and the Contemporary American Theater Festival. As an actor and creative, Corbin has been involved in theater and film, including upcoming Lifetime movies and the Rhode Island International Film Festival. In addition to theatrical work, Corbin has presented at universities through the ARC's Operation House Call, as well as serving as keynote speaker at the ARC's Transition Conference in 2024. Thank you, Corbin, for being here. So now I'm going to stop sharing so we get to see each other and our panelists better. And I'd like to start with, what I'm going to do is ask each panelist a question, but then the others can chime in afterwards. So we'll start with Judith as the transition coordinator at DDS. What should families know about the adult eligibility process for people on the spectrum? And does DDS have autistic specific assessment?
Well, thanks. First of all, I want to tell you that though we both are Jay Doherty, we don't think we're related. So I don't want you to think that Jackie brought her older sister here. Yes, we do have some specific things that when you're looking for eligibility as an adult are a little different. So DDS has two types of eligibility, the process, and then a few different categories. So even if you had children's eligibility, let's say you had a child who had some developmental differences at 5 and you applied and had services, it's important to know that you still do have to apply for adult eligibility because the criteria for adult eligibility is very much different. That's because people grow and change, and sometimes an initial diagnosis is not the same. And they want to make sure that we have the right kind of supports. While DDS is primarily an adult agency, we do serve children, but most of the things in Massachusetts that happen for children are through health insurance in school until they're 22, or in the case of individuals with autism who don't have an intellectual disorder. So formerly known as Asperger's, we now call that ASD only, or ASD no ID, meaning no intellectual disability. The categories are a little bit different. The first and most important thing I can tell you as a transition coordinator is if you're still in school, it's very important for the school town you're from. So let's say you're at a collaborative or a private school. It's not the same. So we're going to just give example. I'm going to say Lexington. If you're from Lexington, but you go to lab, the school department in Lexington should send DDS or whatever agency they think can best support you, something called a 688. And 688 is a bill that was introduced years ago that lets the state agency know, hey, I'm coming and I'm going to need supports as an adult. And so we budget for that. So when the ARC, it's very important to us, goes in to advocate for funds, we do that based on how many people we think we have coming. Now, that doesn't mean if you show up at 50 with a new diagnosis, we aren't going to find a way to support you. But as a transition coordinator, what I can say is this makes a difference to me. So I have a lot of people coming up. The way that the state works is we have different years. So we run a fiscal year starting in July. So the people that are coming up, we call them the class. So I have a very big class of people who are coming up starting July 1st, and we're calling that fiscal 26, the class of 26. And if I know they're coming, I work with that family from the time they come through eligibility as an adult. That could be 17 and a half. It could be 21 years old and 9 months. It's better the sooner it is. And then I work to find the best supports for them. We'll look at what do they need? How do we, again, diagnose this? And what other forms might you get that would help you to go into the proper category so that we can best figure out who can specifically help you with what you're looking for. The important thing to send is the IEP and also the diagnostic information that will be on the eligibility application. And anytime you need help with that, I'd be happy to assist. Anyone else can. The kinds of categories, though, that will come through, Smith-Magenis, Prader-Willi syndrome, those are all a part with or without intellectual disability. And then the people who have autism without an intellectual disability have their own very special set of circumstances, so have their own earmarked category for funding and their own service coordinators. And so the supports look different, because the difference with someone who comes through, like my two children with profound autism, and what they need is very different than somebody who might want supports around job and college and all kind living arrangements. The last thing I can tell you is that if you are in any kind of doubt, we'll figure it out. So you don't have to know this. Just send it all over.
Thank you, Judith. Anyone else on the panel want to talk about transitions?
Sure. I'm 22, so I went through that transitional period somewhat recently, and as Jus was saying, everyone's transition is different. Mine looked a lot different in the fact that I was looking at college and employment. Um, and it is a really interesting time because the amount of services that you get changes drastically, and the types of services that you get change drastically. So that was, that's definitely a period of time that is, it can be difficult. For me, though, it was also very freeing, as I was able to kind of reassess what supports I need in as an independent liver, and figure out, what routines work for me. Um, so, that time, you know, we absolutely need more transitional supports for autistic people, but as Juice was saying, it does look very different person to person, and that transition, even though it sounds very scary, is not always. There are a lot of great things that come with it.
Thank you. Betsy, anything about transition, or do you want to go on to the next question, which is going to be geared to you?
Let's go on to the next question. I think Corbin covered it.
Okay, thank you. So Betsy, as an autism educator with Operation House Call, what do you see as the critical piece Operation House Call provides future medical professionals, and how can people be proactive to make sure their healthcare needs are being met?
Yeah, so for anybody who doesn't know what Operation House Call is, Operation House Call is a program under the auspices of the ARC of Massachusetts, where we as educators go to all of the medical schools in the state. We're also expanding to nursing, PT, and other schools to talk directly to students, like medical students, nursing students, about disability and about how to provide more inclusive experiences for their patients with disabilities. It was actually codified into law a little over a year ago, so which is great. And so we can go to all of the medical schools. And so I get to talk to medical school students, and I really think the biggest value is just helping them connect the dots between what their book knowledge is and real people, right? So, it really just opens their eyes to how autism presents differently, how disability presents differently, and how they can really think about ways to give those patients a better, more inclusive experience from start to finish. One of the best things about the program is that we always have someone with disabilities speaking directly to the medical school students. So um, we have representation, which is, I think, the most important thing. And I think that they get the most value out of hearing from autistic voices themselves. So that's basically the program. And I think, medical school students learn to really slow down and listen, not just with their ears with a medical lens, but also sort of with their hearts and their attention. And, understanding about the importance of relationship building with their patients, understand the importance of being attuned to sensory challenges that might occur in the healthcare encounter, and other ways that they can make those experiences more accessible and more inclusive for our autistic and otherwise disabled community members.
Thank you. Any other panelists want to weigh in on the healthcare piece?
I think you covered it really well, Betsy.
Yeah, I
think
actually
one thing,
didn't answer the second part of the question. I just realized I didn't answer. You asked sort of how can people better prepare for those experiences? That was a second part of that question. Um, I think that, there's a lot of things that patients can do. Self-advocacy is, a really hard skill to learn, and it's an important skill to develop. Being able to really speak up in those environments, and if you are there with a caregiver, one of the things that we teach is that caregivers are an important part of the team in terms of, especially for profound autism presentations, or presentations where communication is much more challenging, really understanding from a caregiver, like, what is somebody's baseline, so that a physician or healthcare provider can have more knowledge about what they're seeing. Writing down what's working, writing down what's not working, asking a doctor to send you follow-up notes if you have problems with auditory processing, or it's overwhelming and you're not going to remember everything, to be able to say, hey, could you follow up this appointment with an email? If you don't understand something, ask them to explain it again, or ask them to draw it out for you, or find another way to explain, because it's absolutely your right to understand exactly what's happening to you in a healthcare encounter. So it's always okay to ask for more information or to ask for more time. And, also to say no to something that doesn't feel right or sound right to you, and be able to assert yourself in those situations. It's one of the things that I coach a lot of my clients on, is being able to really learn that self-advocacy skill.
And I would just interject, those are excellent suggestions for anyone, because I think we're often daunted by the, medical professional in front of us. Well, they know more than we do, and to be able to speak up for yourself or ask questions if you don't understand something, it's very important for everyone to be able to do that. I don't know, anything else? Judith, would you like to add anything, especially for those people who are nonverbal or unable to express themselves? How do you advocate for your loved one who maybe is not able to speak?
Well, that's really a good question. And I recently had experience, this was a first for me, besides my own two with autism. I have a 90-year-old mother I mentioned, and she's very with it. She still actually works part-time and is a writer, but she was feeling dizzy and wasn't as coherent as she usually is. And when I went into the emergency room with her, I realized I had to employ the same skills that I use for my own two with profound autism in trying to say that, no, this isn't the baseline for mom. Mom isn't always like this. And so what I come in and I do lead with, my son has autism, his verbal skills are limited, but he's a very good patient. He's very cooperative, but he will sometimes lead the witness. So if you say, does it hurt in your head? He'll say head. So instead of doing it that way, what I will do is I'll say, Brendan, can you point where it hurts you? And I'll come up with skills. And then I'll also instruct them, particularly even with lab work, don't ask if it's okay if you're going to do it anyway. So if people say, okay, now we're gonna put in an IV, okay? We're gonna put in an NG tube, okay? Well, what's the answer to that? Yes or no? So instead I'll say, just firmly say what you're gonna do. Okay, now to help you feel better, we're going to take some blood work. So we're going to have a little pinch. State it as a fact, not as a question, if you don't want to give them an option to disagree. And also, I guess I sort of alluded to this, but I like to say this is very unscientific. But don't look for a zebra when there's a horse in the room. So sometimes people with autism will come in and the doctor thinks everything's related to autism. So maybe they're hitting their head even for someone with profound autism. And so they'll think this is just something that they do because they're autistic. But no, they may be having something that's bothering them, and that's a behavior that's indicating something. So do what you do with a person who didn't have autism and look for all the signs and symptoms and tests that you need to do. So that's kind of all I would add to it from the profound aspect. And it's really interesting to do this from somebody who doesn't have an intellectual disability but may be impaired. The same thing if someone were unconscious and you were trying to intuit and advocate for them. So you're your own best advocate, or the people you have assisting you, supporting you, can be your own best advocate support. That's what I would really add.
Thank you. Corbin, anything about the healthcare piece you want to share?
Yeah. I definitely agree with like make sure that you're looking for everything because autism can be such an overshadowing diagnosis at times. That being said though, there are so many coexisting conditions with autism that are a little bit rarer. I personally have hypermobile Ehlers-Danlos syndrome and postural orthostatic tachycardia syndrome, both of which are currently considered rare, although we believe that they're much more common that are currently diagnosed. But they you know sorry, lost my train of thought for a second. They are associated with autism in many ways. They're not everyone obviously, but a lot of there is a coexistence that is known scientifically between autism and Ehlers-Danlos and POTS. And I don't know if my Ehlers-Danlos would have been caught if we didn't also know that I was autistic. So like yes, obviously we have to make sure that the autism isn't overshadowing, but it also is something that has to be taken into account. And that is always a difficult balance and it's something that I'm still, kind of grappling with my own healthcare. So it is an interesting balance, and I think that it is something that takes a lot of time and practice to work with, and that doctors are also still trying to figure out. And that's why things like Operation House Call are so great, because it helps medical students start to understand and navigate that balance from the student level, and not, 10 years into their doctorate degree.
Right. Well, I want to jump on that coexisting conditions piece again, because I know there are certain conditions that are common or commonly associated with autism. And I don't know if Betsy or Judith would like to add a little bit more about how that impacts the need for support and medications and other factors, to kind of talk about what are the reoccurring conditions that we do often see. I think there's a list, and I don't have it right in front of me, of many that do occur. I know, Corbin, you mentioned ones that are more rare, but there are common ones. Betsy, did you have any
Absolutely. I
thoughts
know
on?
that there's a huge correlation between GI issues and autism, myself included, but that there's a wide range of that, but like that is, like something like 80% of autistic people. I don't remember the exact number off the top of my head, but it was over 50%.
Yeah, I mean, I would echo everything that Corbin said. I think that there are some common coexisting conditions, epilepsy being one, for certain presentations of autism, GI issues being another, EDS type, the hypermobility type, as Corbin articulated, is definitely associated with autism type 1. But I think, and more importantly than sort of listing what those coexisting conditions are, I think it's really important to make sure that we don't attribute everybody's symptoms to just autism. And that the word for that is fancy word. It's called diagnostic overshadowing. And it's just this idea that, when somebody presents with head pain, for example, to just say, oh, well, they're autistic, instead of ruling out what's actually causing the head pain, right? So again, I go back to that self-advocacy and be really advocating if you know something's up, to be able to, in your healthcare encounters, to be able to say, I really don't think it's that. I really think we need to rule out some other things and ask for tests. The other piece that I think is important to understand about autism in general is that pain perception is different a lot of the time. So people with autism can feel pain more intensely, or less intensely. And that doesn't mean, if they feel it more intensely, that they're being a wimp, for example, right? Like we've heard, I can't tell you how many times when Corbin was younger and I used to take them to the doctor, to have doctors say, well, they're having a fit or they're having a meltdown, and it really shouldn't hurt that much. Well, you're not in Corbin's body. And so you don't know how much that pain is being experienced by Corbin. And we do know that because of sensory differences in the way sensory information is processed, that pain is processed differently. And it doesn't mean that you're a wimp if you experience pain, more, or that, you're stoic if you experience it less. But having providers understand that, and having caregivers understand that, and even having autistic people understand that about their own bodies, I think is really important, to be able to say, like, this really, really hurts, but the doctor said it shouldn't hurt that much, but it does. It just really is devaluing that individual's experience.
I think
Okay,
that's
so-
really helpful, Betsy, because I can say on the other spectrum, my own two don't feel pain very well at all. Sometimes it's such a strong threshold that I won't discover something's wrong until I actually visually have evidence. And And I did want to add in that there are a couple other comorbid things. Autoimmune disorders are fairly common with ASD. Some of those could be everything from psoriasis to diabetes. There are quite a few endocrine. So if you look at the specialties that you see when people come in and submit their supporting documents for eligibility, a lot of times those are related to gastrointestinal. That's what GI means. Crohn's disease, colitis, to things to do with that's an autoimmune disorder. Everything from diabetes and psoriasis. So there's something there. And then we do see some people who also have diagnoses that might be in the DSM-5 as mental health issues, such as bipolar disorder and schizophrenia. Sometimes you'll see 19-year-olds coming in with this who had an autism diagnosis and suddenly but they didn't have these kind of symptoms that are exhibited. And that's something to look for, because you can get I always say this, you can get a cold when you have autism too. Autism isn't the only thing that happens to you. You have to remember that all of these things happen. So yeah, I think that we just have to be aware not to, I love the overshadowing word. I haven't used that before, but not to let that sort of, for everyone on the call, to get in the way of getting to the bottom of whatever is really going on.
So I want to try to get in a couple more before we open it up to the group here. Corbin, what would you tell your younger self if you could go back in time?
I think that would change depending on how old I was. At the very young age before I was diagnosed, around age 10, I would just tell myself that I had, that I was autistic, simply because, spending 10 years of your life knowing that there's something distinctly different from your peers, but not knowing what it is a very scary and isolating experience. So having that understanding as early as possible would, be very comforting for me as a young child. But then once I've understood that that I was autistic, understanding that that's, it's not a death sentence.
Right.
That I can still have an extremely fulfilling life, as an autistic individual. And, there has been tremendous progress in how we talk about autism and the resources for autistic people in the last 10 years or so. But, if I were to look online at autistic resources when I was, 10, 12 years old, it would be very scary. And then we started to change things, and we wanted to make sure that we didn't see it as scary. So we kind of almost went too far in the opposite direction of autism's a superpower and you're differently able. And it's like, well, that's discrediting the challenges that we do face on a daily basis. And so, I think I would tell myself, I would try to explain that dichotomy to myself at a younger age so that I'm not rapidly going back and forth between these views on myself as an individual. Um, I think as I got into my teen years and my transitional years, telling myself, the kinds of things that work for me, figuring out because it took me a while to figure out what kinds of routines work for me, what kind of environments I work best in, I learn best and I live best in. And that, because it took me so long, there were a lot of years where things were incredibly difficult mental health wise and physically for myself and my entire family. And so I think if I could go back and tell myself, hey, this is what works, it would have saved so many years of hardships for a lot of people. And that is just something that takes time.
Yeah, thank you for that. Betsy, what about from your perspective as a mom?
Well, Corbin almost just made me cry, but because that was beautiful. But I think as I think about all the different ways that autism presents, not everyone with autism is going to be able to live independently or go to college, right? So there's joy in all experiences. And I think being able to really try and create a strengths-based lens to all presentations of autism. I know many, many people with profound autism. I see so much beauty in their lives. My life is so enriched knowing them. And I think that it can be, our society can sometimes, especially right now, paint that picture differently. And I think that as a community, we need to stand together and really challenge those assumptions that are coming from the federal level right now to say that it's a tragedy. It's not. I think every life can be absolutely beautiful. There are absolutely profoundly challenging moments, for sure. There are profoundly challenging moments, but there are also incredible triumphs and incredibly joyous and beautiful moments as well. And I think if I were to tell myself, to answer the question, I think my lens has changed by knowing Corbin, by the journey of raising them. And I think, Corbin would attest to, the fact that I had a lot of sort of what's called ableism, right? These ideas of what I wanted my child to be, or I thought my child should be, as opposed to who they actually are. And it took me a minute. It took me a long time to realize that my perceptions were really wrong about my child. And so that is what I would tell my younger self, that Corbin is exactly who they were meant to be. And that that there is absolute joy in knowing who they are, and that that's really true for our community in general.
Thank you. Judith, how do you feel? You want to take this one on? What would you tell your younger self?
Well, I think I had the perspective of having 6 years between my two children, and then having someone I already knew when my daughter was born 6 years later. My son wasn't diagnosed till 4. It was very much more difficult to get this kind of diagnosis. And when she was born, and she was very different and had joint attention, meaning that she'd point at things and I'd look at them and I thought, oh, good, she clearly doesn't have autism. Because when I first went to college and was a teacher, that was one of the things that you looked for. And I thought, that's not it. And so she was so different. I had a chance, though, to incorporate and figure out and accept a little earlier that two could be very different. They could be different genders. They had different presentations. My daughter's science and probably is definitely able to do more things independently than my son, who does speak but is not as independent. But I think I would say to myself, you aren't alone. It was very lonely back in the day, 39 years ago. I really didn't know anybody else, and it was a paragraph this big in my textbook about what autism was back in abnormal psych. It was called abnormal psych. So I thought, this is abnormal. And then I also felt kind of as if Rain Man, I don't know if most people here are young on this call, but in 1988, this movie came out, and really Rain Man was not what my two were like, although my son definitely would learn about things in whole gestalt concepts. That means he learned about babysitters from Mary Poppins. So one day in the grocery store, when my husband, he was doing something and wanted to leave, my husband, he said, I want a nanny who adores the children. And we realized he grasped the concept of babysitters and nannies from this movie. And so I think I would realize at that point that there's a reason for everything. And maybe that what I got out of this is that I was going to come back and be able to give to others, to other people coming behind me, just to say, you will all survive, and any childhood is challenging for any parent. There are some things here that you feel like you're the only person in the world who's doing something at a certain time. I see Lisa and Javon nodding, and you must have had that experience too, that I'd be thinking, oh, I'm upstairs washing excrement off a chair from a desk in a shower, and there's a dinner party downstairs, and people are calling up to me and saying, everything okay? Oh, yes, it's fine. I probably wouldn't have, I think I masked I think I would have not necessarily much asked for help, but I would have been more upfront with how very difficult and challenging this is, and how I just chunk it down, Lisa and Siobhan and every other parent and individual on here, and try not to take on the whole world at a time. And I think that's the best thing, that I just keep going forward. I don't have a choice. My plan A is that I'm going to live forever. So clearly, that's probably not going to happen. So my plan B is I have to put into place enough supports. I want to build a team. Nobody's going to do it like me. Nobody. You get one mother in this world, or if you're lucky, maybe you get a stepmother or you get a second mother. But in general, nobody's going to do it like they did. So I think what I have to just do is just do the very best I can while I'm here for other parents coming along and other individuals to support them. And that's kind of what brought me back out of the profit world back to nonprofit, to just, there must be some reason this happened and maybe I can help. So
Right.
that's it.
So I think that's a great segue into looking at, as a community, what can we do to better support each other? And where do we go to find supports? Whether that's accurate information, resources, just where do we go and how can we support each other better? And that's a general one. So anybody who wants to go first.
Yeah, I mean, I was actually going to say, after Judith was talking, Judith spoke very well on the idea of community for caretakers, which is so important. But community for autistic people as well can be so important as well. So much of what I've learned about autism and the resources that I've found for myself are because I talked with other autistic people who went through similar things that I did.
Mhm.
I discovered the concept of noise canceling headphones through a TV show. And those have been life-changing for me. But even, going on social media and hearing people talk, I found the crutches that I use for Ehlers-Danlos syndrome when my joints get bad through TikTok, I think it was. Like it finding those people, whether they are in real life, on social media, that are sharing those experiences with you, is so crucial, both to just having that community and having that understanding with one another as human beings, but also for finding resources. We are fortunate to live in a world now with social media and the internet being as big as they are, that we're not limited to just the people in our immediate vicinity. We have the entire globe's access to resources. And
I agree. That's so
utilizing
wonderful.
that globe.
That has expanded so many individuals I know who are able to reach out and build their own community during COVID. The silver lining is what we're on right now. We can reach out to other people. You didn't have to get in the car and drive here and figure out transportation, and you can reach out. And if I had had that, that would have been so great. I do want to add that sometimes social media can be difficult, and sometimes that the information you see is one person's opinion.
Of course.
So do not, if somebody says to you, this is impossible, I would go to the source and the authority, because I do see a lot of bad information on some of the groups. So I just
Oh
want
yeah,
to
absolutely. I mean,
emphasize that,
yeah,
that if you're
social
in doubt,
media has emphasized the need for media literacy to an extreme.
exactly.
But
And people can
yes,
be mean, because behind a
yeah,
keyboard, sometimes they feel they're mean. But I do,
but there's
on
so
the
much kindness
subject of
too.
eligibility, and you asked earlier, I just want to say that if someone says, oh no, that wouldn't be eligible and DDS won't let you, or this one won't let you, don't go right to the source, because
Right.
often that's not the case. So sometimes I see some misinformation around SSI and Mass Health, and we'll try to connect you. I don't always know the answer. And you know what? I think the smartest thing you can learn as an old person, being the oldest person on this call, I'm sure, is that knowing what you don't know and saying, you know what, I really don't know. I'm at the end of my expertise. Let me find somebody and connect you, because that's okay to say. You don't have to have all the answers. You just have to know how to try to figure them out, or who to ask.
So we're running very close to the end of time. I just want to reach out to Diane and see if we had any questions in the chat for our panelists or comments to discuss in the last few minutes.
We don't have any questions for the panelists. I'll just quickly congratulate Nicholas, who was going back, he was appointed by the governor to help advocate for those on the autism spectrum.
And Governor Bashir, who's a big friend to the autism community from Kentucky. Nicholas, that is so exciting. I'm so proud of you and so excited for you.
Thank you.
But I think at this point, we can open up if anyone had a question for the panelist.
I just wanted to thank everybody because it was such a rewarding webinar to be a part of. And with Judith, when you were talking, I felt like I was living my past, you know, when
You're my soul sister, Lisa.
when you said you thought you were the only one, that's how I was, you know.
Yep,
So,
I
but
understand.
Corbin, you for how you explain things, and I'm a stroke survivor of 13 years, so it's really powerful to hear things put so eloquently, and
Yeah.
it just put me right. I always felt that about my son Javon, and then when you explained it, it's like, yeah, I got it right. I was right, so thank you for that.
Of course.
I thank everybody, everybody who talked had brought something to me that, I'll hold on to. And just, like, these are what I need. I need more stuff like this. Like you talk about people and their learned experiences. That's the best way. You can't get it out of a textbook or off of the website. I'd rather hear it personally, because Corbin, what you said, I couldn't have felt it if I read it myself. You know what I mean? So thank you, all to each and every one of you.
You're very kind, Lisa.
Thank you for those comments. Thank you all for being here today and for spending time with us. And please don't forget to complete our webinar evaluation, which will follow in your inbox. We really look at those surveys and try to do a better job on our future webinars. And speaking of future webinars, our next webinar is on May 22nd, and the topic will be special needs trusts. So I do thank you all for your time, and special thanks to my panelists. You guys were great, and I appreciate your time. So bye. Enjoy the rest of your day. Thank you.
Bye.
Thank you.
Bye.